Sex addiction is an obsession with sexual thoughts, feelings, or behaviors that affect your health, job, relationships, or other parts of your life. It is also called hypersexuality, hypersexual disorder, nymphomania, or compulsive sexual behavior. Sex addiction is no more about sex than an eating disorder is about food, or pathological gambling is about money. Sex addicts, in other words, are not simply people who crave lots of sex. Instead, they have underlying problems, stress, anxiety, depression, shame that drive their often risky sexual behavior. There is no known cause for sex addiction. However, there are a few theories that are thought to contribute to it. The first is an imbalance of natural brain chemicals. High level of certain chemicals in your brain may be related to compulsive sexual behavior. These brain chemicals also help regulate your mood. The second is sex hormone levels. Androgens are sex hormones that occur naturally in both men and women. Although androgens also have a vital role in sexual desire, it is not exactly clear how they relate to compulsive sexual behavior. Thirdly, conditions that affect the brain could also be a contributing factor. Certain diseases or health problems may cause damage to parts of the brain that affect sexual behavior. Multiple sclerosis, epilepsy, Huntington's disease, and dementia may all be associated with compulsive sexual behavior. In addition, treatment of Parkinson's disease with some dopamine agonist medicines may cause compulsive sexual behavior. Lastly, changes in brain pathways may explain compulsive sexual behavior, an addiction that over time might cause changes in the brain's neural circuits, the network of nerves that allow brain cells to communicate with one another. These changes may present reactions by engaging in sexual behavior and unpleasant reactions when the behavior is stopped. Sex addiction statistics from the Society of the Advancement of Sexual Health conservatively estimate that 3 to 5% of the U.S. population suffers from sexual compulsive disorders. This estimate is considered low because it is based on those seeking treatment for sex addiction. Many of those afflicted avoid exposure and cannot easily be tracked. An individual struggling from sex addiction may struggle with feelings of guilt, shame, and low self-esteem. They may develop other mental health conditions such as depression, extreme anxiety, and stress. They sometimes neglect or lie to their partner and family, taxing or destroying meaningful relationships. They can accumulate financial debts by purchasing pornography and sexual services. They may become in contact with HIV, hepatitis, or other sexually transmitted infections, or pass a sexually transmitted infection to someone else. Addicts may engage in unhealthy substance use, such as drugs or alcohol abuse, and could be arrested for sexual offenses. They sometimes lose focus or engage in sexual activity at work, risking their jobs. Another impact is they may face an unwanted pregnancy and its consequences. Family and friends are also affected from sex addiction. They are impacted emotionally. Family and friends may experience anxiety, stress, resentment, and confusion as the addict withdraws from the family life and responsibilities, listens less, fails to keep promises, and becomes emotionally detached. Socially, sex addictions often flirt, stare, tell sexual explicit jokes, or make inappropriate comments in a social setting, causing family and friends to suffer from embarrassment. Over time, family and friends may avoid social activities with the addict or prevent embarrassing or hurtful situations. Also, as sex addicts become more and more involved in their addiction, they will spend less and less time with their family and friends. Physically, depending on their sexually compulsive behavior, sex addicts sometimes cause their friends and families harm due to rough or risky sexual acts. Sex addicts may be involved in extramarital affairs, which in turn infect their spouses and partners with sexually transmitted diseases. Sexually, sex addicts may or may not be sexually interested in their spouses throughout their addiction. In some cases, sex addicts pressure or force their spouses to engage in sexual acts, while other sex addicts may not want to engage in sexual contact. If you or a loved one is affected by sex addiction, do not hesitate to ask for help.